A burn is an injury to the skin caused by heat, chemicals, electricity, or radiation. Burns can cause pain, swelling, redness, blistering, and scarring. Severe burns may lead to life-threatening complications like infection and shock. Understanding burns and their management is crucial for healthcare professionals. Recognizing the signs and symptoms of burns is crucial for prompt diagnosis and treatment. The presentation of burns can vary, depending on the depth and severity of the injury. Superficial burns, affecting only the outer layer of skin, typically present with redness, pain, and mild swelling. Partial thickness burns, which involve deeper layers of the skin, may exhibit blisters, intense pain, and a wet or weeping appearance. Full thickness burns, the most severe type, often appear charred or white, may be numb due to nerve damage, and require immediate medical attention. Beyond the immediate area of the burn, systemic symptoms like fever, chills, and confusion may indicate a more serious condition. Prompt identification of these signs and symptoms allows for timely intervention and can significantly impact patient outcomes. Burns are classified based on the depth of tissue damage, which directly correlates with the severity of the injury. Understanding this classification system is fundamental for healthcare professionals to determine appropriate treatment protocols and predict potential complications. Superficial burns, formerly known as first-degree burns, affect only the epidermis, the outermost layer of skin. These burns present with redness, pain, and mild swelling but typically heal within a few days without scarring. Partial thickness burns, previously classified as second-degree burns, involve the epidermis and varying depths of the dermis, the layer beneath. They are characterized by blisters, intense pain, and a weeping appearance, with healing time dependent on the depth of dermal involvement. Full-thickness burns, formerly third-degree burns, extend through all layers of the skin, damaging underlying tissues like muscle and bone. These burns appear charred or white, often lack sensation due to nerve damage, and require specialized care, including skin grafting to heal. Accurate classification guides treatment decisions and helps healthcare providers anticipate and manage potential complications. Section 4. Understanding the body's response to burns pathophysiology. Burns trigger a complex cascade of physiological responses within the body, extending far beyond the immediate site of injury. Understanding this systemic response, termed the burn shock, is crucial for effective burn management. Immediately following a burn injury, the body enters a state of hypermetabolism characterized by increased energy expenditure and protein breakdown. This catabolic state aims to fuel the body's healing processes but can lead to significant muscle wasting and weakness if not addressed. The inflammatory response, another key component of the body's reaction to burns, is characterized by increased blood flow and fluid leakage from blood vessels into surrounding tissues. While crucial for wound healing, excessive inflammation can contribute to edema, potentially compromising blood flow to vital organs. Furthermore, burns disrupt the skin's barrier function, increasing susceptibility to infection, a leading cause of morbidity and mortality in burn patients. Recognizing and managing these interconnected physiological responses is paramount to optimize patient outcomes and minimize long-term complications. Section 5. Diagnosing burns, assessments, and tests. Diagnosing burns involves a comprehensive assessment of the patient's history, physical examination, and in some cases, specialized tests. The initial evaluation focuses on determining the cause of the burn, the extent of the injury, and the depth of tissue damage. A thorough medical history is crucial, including details about the time, place, and circumstances of the burn incident, any pre-existing medical conditions, and allergies. Physical examination involves visually inspecting the burn wound for size, depth, color, and the presence of blisters or charring. Determining the burn size often utilizes the rule of nines, a quick method to estimate the percentage of body surface area affected. While most burn diagnoses are clinical, additional tests like blood work, imaging studies, and biopsies may be necessary to assess for internal injuries, infection, or to guide surgical planning. Accurate diagnosis through a multifaceted approach is essential for tailoring treatment plans and optimizing patient care. First aid for burns. Prompt first aid minimizes burn severity and improves outcomes. Remove the victim from the burn source. Cool the burn with running water for 10 to 20 minutes. Avoid ice. It worsens tissue damage. Remove constricting clothing or jewelry. Cover the burn with a sterile dressing. Call 911 for emergency help. Seek professional medical attention for proper burn management.